Okay, everybody hold on here. I just put this up for disclosure, so while you're listening to me speak, realize that I have a few inventions that I have to disclose. I invented one of the anionic salts. I've worked on Imrestor, which apparently is now for sale. So, all right. When you talk about metabolic diseases in cattle and the transition period, they're all interlinked. You all know as practitioners that when the cow gets one disease, she tends to get all the diseases. And I'd like to put immune suppression kind of in the middle of this, because we find as we learn more and more about the immune system of the cow that so many of the diseases we used to attribute to being a metabolic problem, such as retained placenta and perhaps even metritis, are truly immune suppression indicators. On the left, you can see that the effects of negative energy and protein balance are big players in this immune suppression. They have effects on ketosis and fatty liver. It'll affect the incidence of displaced abomasum, all of which are going to affect feed intake even further in this animal and further this immune suppression. Another major disease is milk fever or hypocalcemia. And it doesn't even have to be full-blown milk fever. Just the act of being hypocalcemic has some immunosuppressive action in these cows. Certainly you can get some simple things like loss of muscle tone that can affect an animal's strength of contractions of the abomasum and lead to displaced abomasum. But realize too that the teat sphincter is a muscle. And as these animals develop hypocalcemia, that sphincter muscle fails to close after an animal's been milked, and you see more opportunistic infections around the time of calving. Well, we know animals are immune suppressed because there's a very high incidence of mastitis. About 25% of coliform mastitis cases will occur in the first couple of weeks after lactation. And coliforms are generally an opportunistic infection. We also know that animals can be carrying Johne's disease for a long period of time. They can carry salmonella within their gut for a long period of time. But when you see clinical outbreaks, it's usually in an animal who is just calved. Salmonella outbreaks in the United States are notorious starting in the transition pens. And hopefully towards the end of this talk, I'll make a case that retained placenta, metritis, endometritis, these are all indicators of a poorly functioning immune system in these cows. Here's a study that was done by my colleague Mark Curley and Joanne Dedalou, and they looked at 137 Holstein cows as they went through the parturition period. And they can do several neutrophil and lymphocyte function tests. In this case, it was the ability of lymphocytes to make immunoglobulin when challenged. And so when you look at this, you can see that beginning about 2 weeks before calving, there's a drop in the ability of the lymphocytes to make immunoglobulin. This lasts perhaps 2 to 3 weeks into lactation and then starts to recover. So this period is a period of severe immunosuppression in these animals. Now remember, this is the average of 137 cows. Averages means that there's some cows that sailed through this in good shape, and there's some cows who really did poorly, and we'll get to those later. Neutrophil iodination is a test that can be done. It's a screening test for neutrophil function, pretty general function test. And you can see again that the average cow drops perhaps 30 to 40% in neutrophil function. And again, it takes maybe 2 to 3 weeks into lactation to recover that neutrophil function. Again, another indicator that these animals are severely immune suppressed. Why are they so immune suppressed? There's certainly a lot of things happening in this cow around the time of calving. A lot of hormone changes, a lot of metabolic stressors. When we look at the hormonal changes, certainly a big player is cortisol. And cortisol concentrations are supposed to rise maybe 1 to 2-fold around the time of parturition. Most people feel that this is the signal that initiates parturition in the bovine. But you can see that if an animal is somewhat hypocalcemic or has been overcrowded, we see a bigger rise in cortisol than is normal. And if an animal has full-blown milk fever or has twins, dystocia, mastitis, these levels can get quite high. So we might call this normal level 2 to 3-fold increase physiological, but when you get to these very high levels of 15, 20-fold higher than normal, that's probably pathologic and has immunosuppressive actions on the animal. There are many metabolic stressors going on in this animal too. There's negative energy and protein balance going on in these cows. We're all aware of the negative energy balance, lasting perhaps 5 to 6 weeks in some cows. A lot of mineral imbalances. Some of them are fairly short-term. Perhaps some of the trace minerals might be a little bit more long-term. And certainly some of the vitamins, particularly vitamin E, can get depleted quite rapidly around the time of calving. So we try to ask the question, does milk production alone, irregardless of the level of milk production, alter immune function? And so the way we tried to answer this was we mastectomized some pregnant cows. The idea was that those cows would experience all the hormonal changes associated with the act of parturition, but they would not have any of the milk production stresses. So that's before, and this is after. And when we look at blood calcium concentration, I'm sorry that came out poorly, but that's plasma calcium concentration. When you mastectomize a cow, she suffers no drop in blood calcium. An intact cow, big drop in blood calcium around the time of calving. If you look at her energy balance, which will use non-esterified fatty acid levels in the blood as an indicator, NEFA should be an index of how much body fat is mobilized at any instant in time. You can see again that the mastectomized animals suffer really no change in NEFA levels around time of calving, whereas the intact cows, a huge increase in NEFA in the periparturient period. So what does this mean to the immune system of these cows? Well, here we measure interferon gamma production by cells that were stimulated, lymphocytes. And when we look at these lymphocytes of these cows, we can see that the normal intact cow will show a typical 30-40% decline in the ability to make interferon gamma around the time of calving. By mastectomizing this cow, we eliminated that drop. So this would suggest that, at least for lymphocyte function, a large part of this is due to the metabolic stresses associated with milk production. When we look at neutrophil function, we get a little bit of a different story. Prior to calving, we're seeing the typical drop across all these animals. So this would suggest that those hormonal changes that occur in the last couple of days before calving, particularly the estrogen spike, seems to be a player in knocking neutrophil function way down. After calving, those animals that are mastectomized bounce back and recover their full function very, very quickly. The intact cows remain very low in their function, and it took them about 4 weeks to recover function in this particular study. So that suggests that in terms of neutrophil function, there's an effect of those hormonal changes associated with the act of parturition, and they're also affected by metabolic stressors. So getting back to our little slide here, we'll look at some other factors that cause this immune suppression, and we'll probably focus on hypocalcemia next. So milk fever is often thought to be a gateway type disease. You all know that a cow that has had milk fever is very likely to develop other diseases. You'll see more mastitis in these cows, more displaced abomasum. They're eating less feed, so that again exacerbates ketosis and fatty liver. Again, more displaced abomasum. And it directly affects the immune cells. You get more mastitis in these cows and more retained placenta. This is a survey we did. It was actually done in the year 2001, around the time that anionic salts were starting to really be used as a preventative for milk fever in the United States. This is a sample of 2,300 cows taken from all across the United States that calved within 36 hours of our visit to the farm. I used to work for the United States Department of Agriculture, and we visited farms all over the country. These are samples that were taken within 36 hours of calving, brought the samples back to our laboratory, and ran a blood calcium analysis. We felt that anything from 8 to 10 milligrams per deciliter, so this would be 2 to 2.5, 2.25 millimolar, was normal. Anything below 2 millimolar and down to about, oh boy, I got to do the math, 1.3 millimolar, we considered subclinical hypocalcemia. And anything below about 1.3 millimolar, we said was in the milk fever zone. Surprising to us was that even within first lactation heifers, fully 25% of those animals were hypocalcemic by this definition. When you get to the older cows, more than half of them are subclinically hypocalcemic. Subclinical in that it's very hard to see them, but that doesn't necessarily mean that it's without some kind of ill effects on this animal. Those same 2,300 blood samples, we measured non-esterified fatty acid levels. NEFA, again, an index of how much body fat's being mobilized at an instant in time. And you can see that it didn't matter whether you were a first, second, or third lactation cow. If your blood calcium fell below 2 millimolar, you were going to have a high NEFA level. High NEFA leads to displaced abomasum, fatty liver ketosis. Not a good thing. So what if mom is hypocalcemic? What else does it mean for this animal? This is a study that came out of Ireland some years ago where they looked at the effect of milk fever, so this is not subclinical now, it's true milk fever, on reproductive status of the animals. And what they noticed was that the animals who had gone through their parturition without milk fever, only 8 cases of endometritis out of 19 cows were observed. When you looked at the milk fever cows, 15 of the 19 developed endometritis. And certainly when you look at involution of the uterus, how quickly this is returning to normal size, obviously the normal animals return towards normal involution much faster than the milk fever cows. And I thought this was a nice telling sign here. The number of animals with a corpus luteum. Most animals should be able to cycle by about 22, 23 days after calving, at least have 1 CL. And you can see that 13 out of the 19 normal cows did fulfill this. Only 4 of the 19 milk fever cows were cycling. This is another study that came out of the University of Florida, and this looked at the effect of hypocalcemia on metritis and risk for metritis. And this is an interesting study in that they placed cows into 2 categories, a high-risk category or a low-risk category for metritis. High-risk cows had had some disease like a dystocia, twins, stillbirth, retained placenta, all the things that we were taught in veterinary school that are going to predict that this cow is going to have metritis. Low-risk cows had none of those diseases. And on top of that, they broke the cows into another category. They either said they had subclinical hypocalcemia, which they defined as a blood calcium below 8.59 milligrams per deciliter, or about 2.15 millimolar. So that's a very high target in my mind, but that's the number they chose. And if this cow fell below that level on either day 0, day 1, or day 2 after calving, she was categorized as being in this hypocalcemic area, subclinical hypocalcemia. Now, when we look at the low-risk cows, these are cows that calved normally, no problems. Those cows with subclinical hypocalcemia, blood calcium below 2.15 millimolar, they had 41% metritis. Normal calcemic cows, 14% metritis. So subclinical hypocalcemia made them worse. We look at the high-risk cows. Now we've got cows with subclinical hypocalcemia. Almost 78% of them had metritis. We look at the normal calcemic cows, 20% had metritis. Pretty interesting indictment of hypocalcemia. What's more interesting to me is that when I look at the risk factors, the normal calcemic cows who were high risk had a lower incidence than the low risk cows that had subclinical hypocalcemia. So to me, hypocalcemia is the cause of metritis. Well, now we have to try to understand hypocalcemia. And as veterinarians, we're always focused on the cow who gets sick. But I spent a lot of time looking at cows trying to figure out how they all survived this big drain of calcium from their blood at calving. So if we look at a big Holstein cow, she only has about 3.5 grams of calcium in all of her bloodstream. And we're asking her to make milk that contains 20 to 30 grams of calcium per day. She has to turn over that blood volume 7, maybe 10 times each day to make her milk. That loss of calcium from the blood has to be made up. And it can be made up from bone, or it can be made up from the diet. And the hormone that's going to control all of this is parathyroid hormone. We all have parathyroid glands in our neck. A branch of the carotid artery courses through the parathyroid gland. Any drop in blood calcium causes a tremendous increase in parathyroid hormone. And that parathyroid hormone first can act on the bone fluids and release calcium directly into the bloodstream. This is very fast, but fairly limited in size, maybe 9 grams in a normal cow. We've learned that cows that are on anionic salts, that number jumps up to 15 grams because of the bone involvement in buffering the acidity of the blood. Osteoclasts can be recruited, and they can bring in lots more calcium. The average cow loses close to 13% of her skeleton in the first 5 to 6 weeks of lactation. But this is not going to be a very fast response. It may take 3 or 4 days for this to really crank up. Another aspect of this is dietary calcium absorption. And so people put cows on diets anywhere from 45 to 150 grams per day is rather typical. Parathyroid hormone acts on the kidney and gets the kidney to take this vitamin D that we're feeding the cow and convert it into a hormone called 1,25-dihydroxyvitamin D. This hormone acts on the intestinal epithelial cells and stimulates the active transport of calcium across the gut. Without vitamin D on board, we can only rely on passive calcium absorption, which is probably not effective enough to keep this cow on her feet. So parathyroid hormone is the key player here in controlling all this metabolism of calcium. A few years ago, we did a study looking at older Jersey cows, and we fed them either a high cation diet, a diet that was very high in potassium, or a diet that was lower in potassium and also had anions, chloride and sulfate, added to the diet to help acidify the cow. When we looked at those cows, we had them nicely acidified and we had them very alkaline. We then gave them parathyroid hormone injections, synthetic parathyroid hormone. They all got exactly the same dose per kilogram of body weight. Then you look at the response, and you're looking at blood calcium here. The acidified cows actually start out a little bit lower in blood calcium, but they rise very quickly once they start getting the parathyroid hormone injections every 3 hours. The cows that are on the high DCAD diet, in other words, they're alkaline, high potassium diet, they start responding to the parathyroid hormone, but it takes them quite a while, and they never quite reach the response of the animals on the anionic diet. Similarly, remember that one of the actions of parathyroid hormone is to turn on production of 1,25-dihydroxyvitamin D. Here you can see that our anionic diet cows respond very, very quickly to that parathyroid hormone injection and make a lot of 1,25-vitamin D. The cows that are on the high potassium diet fail to respond until maybe 24 hours after treatment. We think this is why cows get milk fever. High potassium diets put them in an alkaline state. It reduces the responsiveness of the tissues to parathyroid hormone. And that's illustrated in this little cartoon. In panel A, we've got a normal cow. Let's say her blood pH is about 7.35. Probably what most of us are sitting at in this room is about 7.35. And we've got plenty of magnesium on board. In this case, the parathyroid hormone is released in response to hypocalcemia that's developing in the animal. It binds to its receptor in a nice lock and key fit, and then that stimulates an adenyl cyclase complex. And then that produces cyclic AMP, and cyclic AMP is the second messenger that signals the cell to begin to do something. I know you all hated this in endocrinology, I did too, but unfortunately you have to learn some things. In the second panel here, we've got a cow who was alkaline. And this alkalosis that she's in has changed the shape of this parathyroid hormone receptor. Now she releases parathyroid hormone. It doesn't bind to its receptor very well, does not stimulate the adenyl cyclase complex. The cyclic AMP is not being made. These are bone tissues, the kidney tissues. They're surrounded by tons of parathyroid hormone, but they don't recognize it and fail to respond. Eventually, they will respond, but it's going to take them time to respond, time that the cow doesn't have. In the third panel, which we'll come back to later again, we've got a situation where the animal is acidified, but she has hypomagnesemia. And if you notice in these two cartoons, there's a little magnesium atom sitting on top of the adenyl cyclase. Without that magnesium present, adenyl cyclase won't work. So we can still stimulate the receptor with parathyroid hormone, but because the magnesium atom is missing, we can't get full activation of the bone and the kidney cells. And again, the animal will develop hypocalcemia. So how do you prevent milk fever? Well, avoid these high potassium forages. Most dairies in the United States are familiar enough with this concept that they're really trying to keep potassium in the diet low. Adding anions to the diet to reduce the blood pH and urine pH. You'll see some work later that will look at this urine pH idea and the acidification. We can use that as a good way to monitor whether our diets are functioning. In most cases, urine pH reflects what's going on in the blood, and it's a lot cheaper test to run. Diet magnesium, we try to keep it about 0.4% to make sure that we've got a little magnesium atom sitting on top of that parathyroid hormone adenyl cyclase complex. And the key here is that it be bioavailable, and I'll give you a little test you can do at home. Another way to prevent milk fever is to reduce the dietary calcium prior to calving to try to stimulate parathyroid hormone release long before calving. And if you can do this successfully, in other words, you have to get dietary calcium really low, you can stimulate the parathyroid to begin producing hormone a week or so before calving, and that will be a long enough period of time that it will overcome this resistance to stimulation, even in the face of a high potassium diet. We'll talk a little bit more about a way to get that accomplished. So adding anions is what America seems to have adopted for the most part. It has problems. Anionic salts are unpalatable, so those people who've tried to use the traditional anionic salts like calcium chloride, ammonium chloride, ammonium sulfate have found that the cows just won't eat it very well, and they might not get milk fever, but they seem to get just about everything else you can think of. Over-acidification is another problem. If you over-acidify these cows, again, they will go off feed, and then they develop all the diseases you'd expect from lack of feed intake. So there's some tricks to it. Collecting urine and running the pH on the urine has kept me out of trouble over the years. Believe me, when we first started playing with anionic salts, I made a lot of mistakes. And there are certainly 3 or 4 driveways in the state of Iowa where the farmers see me coming, they get out the shotgun because I wrecked their cows. Once we learned how to do it correctly and use some of these commercial products that have been developed, things have gone a lot smoother. So again, I wanted to point out the idea that magnesium is critical to this whole situation as well, and realize that in ruminants, once they become adults, the rumen is, for all practical purposes, the only place they can absorb magnesium. And so if magnesium is to be absorbed across the rumen wall, it has to be soluble in rumen fluid, and that's part of the trick. Now, there's an active transport process across the rumen wall that we would hope would take care of the situation, but unfortunately, many of these transport processes are easily poisoned by potassium in the diet. And nitrogen in the diet seems to be another factor that blocks these transporters. The passive transport system, The passive transport system basically works so long as the high ionized magnesium concentration in the rumen fluid remains high. So your goal is to make sure this animal has plenty of ionized magnesium in the rumen. And by ionized, that essentially means it has to be soluble in the rumen. So we try to keep diet magnesium about 0.4% to take advantage of that passive transport system. A key is that the magnesium source has to be finely ground and not overly calcined, overly heated. So once you get up above about 58% magnesium in a magnesium oxide source, it's probably been over-calcined. It won't be very available to the animal. I'll show you how to do a test for that. Hypomagnesemia, another test you can do for your cows, is pull a blood sample within 12 hours of calving. Anytime you see a blood magnesium less than 1.9 millimolar, and 1.9 milligrams per deciliter is about the same number, you're going to see a problem with hypomagnesemia affecting the animal's functions. Ordinarily, the textbooks would tell you that's just fine. Grass tetany doesn't occur until she gets down to about 1.2, 1.0 millimolar. But this effect on the parathyroid hormone receptors occurs at much lower, or a lower threshold for blood magnesium. Certainly at about 1.7 milligrams per deciliter, we see this parathyroid hormone receptor doesn't work very well. Another thing about hypomagnesemia and early lactation is you'll see these animals aren't eating very well. Their fermentation doesn't go very well, and certainly you can get grazing dairy cows that actually go to full-blown tetany. Magnesium sources, mag sulfate, mag chloride, are often used in the pre-calving rations in America as anionic salt supplements. The beauty of those is that they're very, very available, and usually we see no problems with the cows prior to calving. The problem in America is post-calving, when the farmers all rely on magnesium oxide to be the source of magnesium in these diets. And they do that for two very good reasons. Magnesium oxide is cheap, fairly palatable, and it's a rumen alkalinizer. So during lactation, we would like to use this to help alkalinize rumen fluid. My experience, I just threw this sentence in here, it has no context, but just the idea that whenever I've seen milk fevers in mid-lactation, 75% of the time I can trace it back to a problem in magnesium. So just keep that thought. So maybe you've got a magnesium oxide, and I'm putting this test up here because, at least in America, we are plagued with poor quality magnesium oxide. And it's very cheap, but you get what you pay for, I guess. So if you want to test some magnesium oxide at home, weigh out 3 grams of mag oxide, put it into a vessel, add 40 mils of white vinegar. White vinegar is typically 5% acetic acid. Cap the container and shake it well, and shake it again at about the 15-minute time point, and then let it sit 30 minutes and check the pH. The straight vinegar will have a pH of 2.6 to 2.8. If you've got a good magnesium oxide, it'll bring that pH up above 8. If you've got a poor one, the pH stays around 3.8. So let's say 3.8 to 8.2, that's a 5-fold difference, almost, let's say 4-fold difference in logarithmic scale. So being a log scale, that represents about a 10,000-fold difference in buffering action. You would be surprised how much cheap crap is on the market. So another idea to prevent milk fever is to reduce the dietary calcium. In America, we have a tough time getting this low enough to really be effective. Zeolite is an interesting compound that's been developed in Denmark, and it binds calcium. And hopefully it binds enough of the calcium that when you include it in a low calcium diet, perhaps you can do the low calcium theory and stimulate parathyroid hormone release before the animal calves. In the United States, we still may have too much calcium in all of our diets to make this work, and it's not yet approved in the United States. It is approved in Canada, and I've yet to hear how it's working there. But I've heard from the Danes and others that they seem to think this is working quite well. Oral calcium therapy can be given. Drench them, pump them, bolus them, drench them. All those things are good fixes for about 6 to 10 hours after a cow calves. That doesn't mean they're without utility. It just means that it's only going to buy you about 6 to 10 hours of normal blood calcium. We'll move back into the effects of energy and think about the effects ketosis can have on immune cell function. We've got fatty infiltration of the liver going on, so that's going to affect acute phase protein production. We've got failure to produce glucose by that liver, which means you're removing one of the big fuels that immune system cells like to use. And there's some effects of ketone bodies themselves, the BHBA. Certainly the NEFA, high NEFA levels will directly affect immune cell function. This is an old study now, but it's still one of the great studies. This was a study where they looked at the production of alpha interferon by lymphocytes in culture. Now, alpha interferon is produced by lymphocytes whenever they run into a virus. And the idea is they're going to produce this and tell all their neighbors, hey, there's a virus in the area, try not to get infected. Well, in this case, they took the lymphocytes from normal cows with subclinical ketosis, which at that time was a +2 on a keto sticks, and a fully ketotic cow was a +4 on the keto sticks urine analysis. They stimulated these cells with Newcastle's disease virus. Now, Newcastle's is an avian pathogen, right? Why would you choose to use that to stimulate cow lymphocytes? Well, the beauty of it was they knew all the cows would be making a naive response. None of them had been exposed, hopefully, to Newcastle's disease virus. So you're seeing an immediate naive response to the animals. The normal cows made 980 units of interferon, subclinical, about 1/4 of that, and full-blown ketosis, the response is almost negligible. So negative energy, high ketones really zap the immune system. It really knocks it down. Negative protein balance is the next one I want to bring to your attention because most of us neglect the effect of proteins. It's going to last maybe 2 to 4 weeks in early lactation, and glutamine is a major source of energy for many of the immune cells. Here we see blood glutamine levels. The arrow here designates the time of calving, and these big arrows are weeks after calving. And you can see that glutamine levels drop by nearly 50% in the blood during that first week after calving. We can look at a lot of the other essential amino acids, and most of them will take a small drop, or actually a fairly large drop, for about a week, maybe 10 days in early lactation. If you're missing these essential amino acids, how is the animal going to make immunoglobulin? Those are made from amino acids. How is it going to make new white blood cells to combat a disease? Those are made from amino acids. This animal is negative protein balance. It really affects how well they can respond to a disease. How can we fix these things? Well, that would take a lot more than the 40 minutes they allotted me. In America, we've started using high straw or low energy diets to keep cows hungry throughout the periparturient period. I'm a strong believer in it, and one of the other big reasons I use them is because I got tired of doing displaced abomasum surgeries. This really cut down on the number of displaced abomasums as well. We have farmers who've made decisions who've said any cow with a body condition score of 4 at dry off, irregardless of the fact she's pregnant, I'm putting her on a truck and I'm selling her because I'm tired of dealing with these fat cows. Fat cows are where you spend all your time in this periparturient period. Many people are giving propylene glycol or perhaps glycerin as drenches to every cow when she freshens. It's a lot of work, but there's some nice studies out of Cornell in the last year and University of Wisconsin suggest that this might not be a bad tactic. And certainly there's all kinds of additives that are promoted to remove the effects of energy balance in cows, and some of them work and some of them are less than what we would hope. For protein balance, make sure you're getting enough metabolizable protein into the cows. That's somewhere around 1,100 to 1,200 grams of metabolizable protein each day. It's not simply putting them on a 14% protein, crude protein diet. Look at the metabolizable protein. This is also the place where you might use bypass methionine, rumen bypass lysine if it's available. Hypocalcemia and disease resistance. Again, the idea that this hypocalcemia affects muscle function, the teat sphincter, failure to expel contents of the uterus. Calcium is second messenger for the immune cells. So if it's low, you'll see immune suppression. I want to switch gears a little bit and look at this cow with a retained placenta. Is she immune suppressed? You remember that the fetal tissues, the trophoblast, this belongs to the fetus, and the caruncle belongs to the mother, the dam. And this interface here needs to separate when the cow calves. And this failure to separate is now thought to be an immunological function. A famous Dutchman named Gunning did some great work on this many, many years ago that pretty much never saw the light of day. So we tried to repeat some of his work and put some new twists on it to see whether or not a change in chemotactic activity of cells around the time of calving predicted that a cow would get retained placenta. So my graduate student, Kayoko Kimura, grabbed white blood cells from cows. Basically, she obtained neutrophils and puts them in a Boyden chamber where you've got this membrane. And below that membrane, she had homogenized placenta from a cow who had cleaned normally. We've done the experiment with cows that did not clean normally, and you get even worse results. But here's a cow who cleaned normally, so normal placenta. You put the white blood cells on top, you incubate them for a little while, and then you look at the underside of this membrane because this membrane has pores in it, and the neutrophils will climb on through those pores and line themselves up on this bottom membrane. And you can look at it under a microscope, and those blue-stained neutrophils are very prominent in a cow who has cleaned normally, who does not have retained placenta. Here's a cow with retained placenta, and you'll see only a few of these blue dots. These halos are actually the pores in the membrane. We can graph this out, and you can see with calving being right here, that beginning perhaps as much as 4 or 5 days before parturition, these cows that are going to develop a retained placenta have a very significant loss of chemotactic activity towards placental tissue. Normal cows stay nice and high throughout the period. When we looked at these cows a little bit further, we found there was plasma interleukin 8 that predicted whether or not they were going to have retained placenta. And interleukin 8 is lower in cows with retained placenta than it is in normal cows. We did a study with Doug Hammond, too, where we looked at cows going through the periparturient period, and we looked at cows with metritis, which we diagnosed as a foul-smelling, watery discharge with or without a fever in the first 10 days of lactation. Many farmers in the United States rely on a guy to go behind the cows and stick a thermometer in the cow and figure out if she has metritis. We know that you'll miss 1/2 of the cases if you rely on a thermometer for diagnosis of metritis. A lot of them never show a fever. Endometritis was diagnosed 28 days post-calving by uterine wash cytology. We could look at things like beta-hydroxybutyrate, and we see a nice rise in beta-hydroxybutyrate in normal cows, no metritis, and it comes down by about 10 days, 2 weeks into lactation. Cows with metritis, that level keeps going up and up and up. We all expect this. Cow doesn't feel good. She's not going to eat very well. Of course, she'll develop more ketones. NEFA levels, again, here's the cow calving. NEFA levels are very high in the cows with metritis post-calving compared to no metritis cows. But now we're getting into the interesting stuff. These cows have higher NEFA levels even before they calve. There's no metritis yet. That hasn't started them on this path of failure to eat. They're failing to eat properly even before they calve. And we look at neutrophil function. Again, the normal cows show that 30% decline in neutrophil function. These cows with metritis, that can be an even larger drop. And it actually starts the day of calving, maybe even before calving. We look at endometritis. Those cows are, again, our normal cows, 30% decline. Endometritis cows, maybe a 60, 70% decline in neutrophil function. And it takes maybe 4 weeks for them to recover that function. So again, these animals are developing metritis because their neutrophils are shot. They're not working. What could we link this to? Well, the only thing we could link it to was a failure to eat. Here's the cows calving. These cows that are going to develop metritis are not eating as well as the cows who are going to be normal even 1 to 2 weeks before calving. Why aren't they eating well? This study was done in a tie stall barn, by the way, so there was no competition among the animals. Why were these cows destined to have poor intake and poor outcomes with their uterus? So when we look at nutritional immunology, there's a lot of energy factors, protein factors. The vitamins can be big players in this, particularly vitamin E, copper, zinc, selenium, all those things are factors. A new player has emerged on the scene, and we started working on this back in 1988, granulocyte colony stimulating factor. My colleague Mark Curley did a lot of work on this a long time ago. And this is basically a cytokine that's released by macrophages and other type of immune cells to stimulate growth of new neutrophils. It basically works in the bone marrow and causes proliferation of neutrophils. And basically what you're going to see is that cows that have been given this granulocyte colony stimulating factor will see about a 5-fold increase in white blood cell count, primarily neutrophils, through this periparturient period. Now, in some cases, we found improved function. This is a myeloperoxidase test. But I have to tell you that many of our tests showed that the neutrophils were still not functioning properly. But the idea is that I can send a one-armed guy into battle against a two-armed guy, and he's going to get killed. But if I send 5 one-armed guys in, they have a shot at beating a two-armed guy. So the idea is to overwhelm infections with numbers of bacteria. A lot of other issues with cows that involve herdsmanship, the way you move cows, the way you stock cows. I put this slide in to show the effect of movement of cows. This is number of days in the close-up pen. So this happens to be the winter time, this happens to be the summertime. But if you moved a cow within 7 days of calving, her milk production would be quite low compared to a cow who had a full 21 days in that close-up group. That was irregardless of a dietary change. Many of these cows were staying on the same diet. More important to veterinarians, we looked at the effect of days in the close-up pen on mortality. And this happened to be a herd that was going through a terrible time. 50% of cows who calved within 5 days of being moved were dead. 6 to 10 days, still a lot of them died. The cutoff, and this is held up for many herds over time, you have to have at least 10 days in that close-up pen to have any chance of making it. And certainly when you get out closer to 21 days, the mortality rate is much lower. So I've given you a lot to think about, probably more than you wanted. And all these diseases are interlinked, and hopefully I've convinced you that immunity is somewhat important to the metabolic system. Thanks. Sorry, I went over. No,